And now to this here at 5:30. COVID cases still inching up across the country, making now for 56 high-risk counties nationwide where the CDC says people should be masking up again. Now, those areas are mainly in the Northeast, but as WCNC Charlotte's Chloe Leshner reports, here in the Carolinas, experts are keeping a close eye on two new variants of concern.
The latest data released by the North Carolina Department of Health and Human Services today shows that BA.2 is still the predominant strain of COVID being detected in the state, but those newer subvariants appear to be more contagious. The Omicron variant and its mutations continuing the COVID cycle as cases slowly climb again.
100% of our sequenced specimens continue to be the Omicron variant and its lineage. So certainly as additional subvariants of that particular variant are emerging, it's kind of unclear at this point what the consequence of that will be.
The Omicron variant was first detected in South Africa. Now mutations of it, subvariants BA.4 and BA.5, are causing a spike in cases there. Research that has not been peer-reviewed yet shows people who were previously infected with Omicron may not have immunity to these new strains. Future waves of new cases expected as we adjust to living with COVID.
In the fall, we would expect that we would, similar to what we have the last several years, we would start to see an uptick in cases similar to what we're seeing right now.
Some good news, even as cases rise in the Carolinas, data shows healthcare systems are still in good shape compared to earlier this year.
So far, we're seeing more in our wastewater than we're seeing with those other metrics, which is a good sign because that means, people may be getting sick with COVID, but we're not seeing the cases being as severe.
Experts are still encouraging people who have not been vaccinated to do so, and for those who are eligible to get their booster. They say that is what protects you from having a severe case of COVID. In Uptown, Chloe Leshner, WCNC Charlotte.